Hi, it's Rafaela from Migraine Australia, and today, as part of Migraine Awareness Month, we are talking to the fabulous Anne Swain, Head Dietitian at the Royal Prince Alfred Hospital Allergy Clinic. Thanks for joining us, Anne.
Thank you for inviting me.
That's all right. Let's get started with just a little bit about you and what the Allergy Clinic is and does.
I've been working at the Allergy Clinic for nearly 40 years in this area of food intolerance, along with Dr. Lobley and Dr. Valencia Suter. And we've been looking at patients with food allergies and food intolerances and any other adverse food reactions that people come to us wanting to know about.
Okay, do you get a lot of people with migraine through the clinic?
We get a lot of patients with migraine through the clinic, and they may have migraine on its own, or they may also have other symptoms as well.
Like me, lots of allergies.
Yes. And the ones that come to the allergy clinic, they're usually wanting to look into the role of diet in migraine because they know that we have a particular interest in the role of food in adverse food reactions.
So for those who aren't familiar with it, what is the elimination diet and how does it work?
The elimination diet is a diagnostic diet. It's a test diet which excludes all the foods and the food chemicals that are capable of provoking reactions. And it's not a diet on its own. It's actually a diet and challenge protocol. And so you've asked me right up front, so I said I'd give you a few little diagrams. This is the little diagram that I talk about, and you can see I've got some little tabs there to talk about the elimination diet testing process. So the elimination diet is really asking the question, does food play a role in your symptoms? And then if they improve on that elimination diet, we then go ahead and do challenges. And these can be with foods that contain particular chemicals or with the pure chemicals. And what we're asking is which foods or chemicals trigger your symptoms. Then the next stage is what we call liberalization. And that's when we add back the foods that they didn't react to on challenge. Mm-hmm. And when you're doing that, you're trying to work out and check whether you've got it right. And we call that stage your personal diet because not everybody reacts to everything. And one of the things that a lot of people talk about is, oh, if you've got migraine, well, then these particular foods or these particular compounds may set you off. Whereas in fact, for a lot of people, it's variable to the degree. So we give them then what we call their personal diet. And then we encourage them to find their threshold. And finding your threshold is adding back small amounts of the foods that contain the chemicals that you reacted to on challenge to find out what your threshold is. How much can you get away with before you get into trouble? Because this diet is not like an allergy diet. It's not, I can never have the compounds or the foods. It's how much before I get into strife. And then the fourth stage is long-term management, adjusting your diet, balancing your food, your symptoms, your lifestyle, because none of us want to stick with a strict diet all the time. There are occasions when you go, look, I'd like to have some discretionary foods, a wedding, I'm going out, or I've just, what the heck, I'm going to have some of this and see how I get away.
I want some ice cream. And that's it.
Exactly.
And that's okay.
I'm going to have it.
Yeah.
And I don't think that's a bad thing. That's normal life. None of us stick to a strict diet. So when patients come and see me, I often say to them when they walk in the room, okay, tell me what's happened since you last saw me. Because I want to know about those little indiscretions that you've either chosen to have or have had them imposed on you socially or for whatever reason, because they reinforce and they tell you, yes, you've got it right again. You know, if you overdo something and you get your symptoms, you go, oh yeah, here I go again. The difference with that in the long term is that you know how to make yourself well. You know that if you go back to your personal diet, your baseline diet, you can get yourself well again. So you've got a choice about when to feel unwell and when not to feel unwell. Whereas when they first come to me, it's interesting. Over 90% of our patients come in recognizing at least one food where they either know definitely or suspect that it could be giving them symptoms. Doesn't do so all the time. That's another trap, you know. Oh, sometimes I eat chocolate and it makes me feel dreadful. Other times I'm fine. And then they go to their doctor and their doctor looks at them and goes, well, that doesn't make sense. And it does make sense if you think about it from a threshold point of view, that the chocolate is the last thing that they consumed. And again, a little diagram that we've put in our little booklet. You know, the chocolate is the naughty but nice last one. But what about all these other foods that contain the same chemical? And so if you eat the chocolate here, it's not going to be a problem. But if you eat the chocolate when you're here, you're going to easily go over. And so that's another principle that makes it a little easier for them to manage. And then the other thing that we find is 50% of patients who come to the allergy clinic actually have tried some sort of diet. So when we see patients, they're usually wanting to come and document what is setting them off in an organised way. The other thing that I'd want to highlight is that you're a group of people that the main problem is migraine. But you often will have other symptoms. And when we've been collating our results, what we've been, as we're doing currently, what we're very well aware of is that with food intolerance, not only will you have headache type symptoms, but if your target organ is the skin, you can get itchy rashes, hives, and eczema. If your target organ is the gut, you can get chronic mouth ulcers, nausea, vomiting, diarrhea, tummy pains. If your target organ is the central nervous system, you can get the headache or migraine, the fatigue, etc. And if your target organ is the respiratory tract, you can get the drippy noses, the exacerbation of your asthma, etc. So it's important to recognize that there is a range of symptoms that people can suffer from. Some people are lucky that they only suffer from one condition like migraine or headache, but they will often get gastrointestinal symptoms, or they might get respiratory or skin symptoms at the same time. But when they come to the clinic, they come because of the symptoms that bug them the most, the symptoms that are taking over their lifestyle. And for a lot of them, when I go through this, they go, oh yeah, I get symptoms, gut symptoms from time to time. I get skin symptoms, but doesn't everybody? And I go, no, they don't. But they're not the symptoms that have prompted you to come and see us at the clinic.
We have lots and lots of people with migraine that also have gastrointestinal problems. So is a food intolerance the same as a migraine trigger? Like in the body, is the same kind of reaction going on?
When you look at the literature, and I looked that up before I talked to you, and there's another lovely little diagram out of our book that I would like to show you. Because I'm showing you these diagrams because I think they will help your members. When you're looking at migraine, let's start with migraine. And I just looked up on the internet the Migraine Trust, which is the UK one, you know, and they talk about the common triggers are hunger, dehydration, stress, changes in routine. And then they added in too much, too little sleep and exercise, weather changes, computer screens, hormonal changes, medications, physical conditions. It's a long, long list, okay? And then they talk about food and the lack of food or missing meals. They also talked about sugary snacks. And with sugary, you know, instead of a balanced meal, they talked about additives like glutamate, nitrite, aspartame, and they said, we're not sure about chocolate. Okay. And I'm going through those because I'm then going to talk about the triggers for food intolerance, and they almost look the same. Okay. So when you're looking at the triggers for food intolerance, not only the food can trigger it off, but so can some medications, so can physical and mental stress, so can illness, and so can hormones. We feel these reactions are affecting the nerve endings, and when you eat food, they tickle up the nerve endings in your mouth. Those nerve endings are all the way down your esophagus. They tickle those up. You're wired up to your spine. Messages go up and down and then come back to the periphery. And they come back to your tender spot, your soft spot, you could say your weak spot. So for some people, it's headache and migraine. For some people, it's bellyache. Sorry, I use my hands a lot.
It's
A bit hard with COVID, but hello, that's the way it is. So sometimes it's headache and migraine. Sometimes it's bellyaches or reflux or all those sorts of things, okay? For some of us, it's skin rashes, and for some of us, it's drippy noses. And so the same sort of thing, it just depends on the individual what symptoms you get. And so the same sort of triggers, that's why I was reading this through and I'm going, yep, I could identify with that. Sugary snacks, for instance, you know, everybody's thinking sugar, but what's the common denominator there? Cakes, biscuits, lollies. And what's in those things? Flavors, colors, preservatives. It may not be the sugar, it may be all those other things. And you know, when you're not feeling very nice or good, that's when you're going to go, if you're a sweet tooth like me, you're going to go and give yourself some lollies or chocolate or something like that. A lot of women say to me premenstrually, they know it's going to give them a headache, but they eat a whole lot of chocolate. You know, so you've got the hormonal change, and then what you dose yourself up with food. When you're stressed, what do you do when you're stressed? Now, some of us don't eat. I wish I was in that category. I worked with a dietitian once who, bless her cotton socks, I was so envious of her. Every time she was tired, stressed, whatever, she wouldn't eat. I'm going, oh no, where's the food? Do you know what I mean? That's the first thing we will look for. And chocolate is that naughty but nice food. It hits all the taste buds. It's got the fatty taste. Oh, I feel much better. I've got a bit of a sugar hit. Well, you've got a lot more than that. And then on this site, they talked about glutamate and nitrite. When I was putting this elimination diet together, I started with patients who just had hives. And the literature back then in the 70s was talking about natural salicylates or natural aspirin in your fruits and veggies, etc. And it was talking about artificial colours and preservatives. So I started my diet doing that. The first few patients came back and said, Doc, my symptoms have gone away, and when you challenged me, they came back. But also my belly aches came back, my headaches came back. That's when we started to look more broadly. And in the literature, it was well documented that glutamate and nitrite, you know, they talked about the hot dog headache, they talked about the Chinese restaurant syndrome and that tight feeling in the head, etc. So when I started to hear that story, I looked more broadly in the chemicals. And of course, there was a lot in the literature about amines in food. And the challenge material that they used was tyramine, hydrochloride, and beta-phenylethylamine. Big words. Beta-phenylethylamine is the main amine in chocolate. And you don't need very much of that if you're a sensitive individual to set off a reaction. Tyramine was the amine in cheese, and serotonin is the main amine in bananas. So once I started to hear that story of this wider scope of symptoms, as I showed you in that diagram, that's when we looked at a wider scope of the chemicals. It did not change the diet at all because we already had a very baseline diet. It just meant when we were challenging patients, we challenged them with the natural salicylates, the natural amines, the natural glutamate, the added MSG, and then the colours and preservatives in food. And then with people with gut symptoms, we found that often wheat and milk and soy set off their gastrointestinal symptoms. And people say to me with wheat, what is it in wheat that sets it off? We've now changed it from a wheat-free diet to a gluten-free diet. That seems to be the trendy thing now. We're avoiding exactly the same things. But when you're avoiding the wheat/gluten, you're also taking out a lot of the natural chemicals, the additives. So you're making a big change in your diet. And the same with dairy. What is it in dairy? People will blame the protein, the lactose, and those things all have their place. But cows graze on pasture and milk is combined. And coming from a dairy farm, the flavour of the milk can change depending on what the cows munch on. And so my father used to say at certain times of the year, I'm not putting the cows into certain paddocks because otherwise they will taint the milk. So there's all those other things that are added to milk, and the same with soy. So when you ask me a very long answer to a short question, where are migraine and food intolerance? Where are they similar or different? They're one and the same. It's that more that when you're asking me about what are the food triggers for migraine, I'm going similar triggers can trigger off other reactions in other individuals. And in your group, one particular food chemical may set off their migraine, but it also may set off their gastrointestinal tract, or it may set off their headache or their nose, etc. Or it may set off not just migraine, but a whole lot of other symptoms like fatigue, etc.
That's all really interesting information, and I think a lot of people will have learnt a great deal. One of the things for me personally going through the elimination diet was that I knew what was in my food, and I kind of had been educated, so I could then read a label and read the chemical numbers and understand what those things were, and then avoid or not as I saw fit. There's a lot of diets around, and certainly I've been given migraine diets by doctors, other people have too, and there's some popular ones online like the Heal Your Headache diet, which I think you've heard about. What's the difference? Is it worthwhile trying those diets, or should you go straight for an elimination diet?
Some people decide that they will try those diets out, and I don't think there's anything wrong with that. What you're doing is, if you think about your chemical load being here and you're eating up here, on some of those diets, what they will do is just reduce it. And for some people, that will give them enough relief that they're happy. For others, that diet may bring their chemical load down here and they're completely well. In other words, they're not quite so sensitive. Or they're being a lot more careful about their food. But it doesn't answer the question, which things give you what symptoms? And the problem with a diet like that is you can be bumping along like this, and then you might have a little bit more of foods that you think are okay, and through you come. And you go, I'm following the diet, and I get symptoms, and I can't work out what set it off. So the advantage of the elimination diet, it is tough, but it's about getting you well, having a clean baseline. So if this is my threshold, I come right down to here, and then I do challenges with compounds one at a time, so I can see whether they go through, whether they're relevant for me or not. Not all people react to all the compounds or all the foods that can set off a food intolerance reaction. My concern with these diets is that you may or may not get to work out what your actual triggers are. So the diet you were talking about, again, I went online because online's fabulous, Google's fabulous, and it talks about, avoiding the quick fix, reducing your triggers, and then looking at where your thresholds are. It says we're going to strictly avoid, the words are almost identical to what we're doing. Strictly avoid all potential dietary triggers, tick. And then the person said, I even cried in the first 2 weeks, because a lot of people can go through a withdrawal effect in the first 2 weeks where their body's going, what have you done to me? That's the time to press on, not to go, well, this is not working. Your body is saying, I don't like what you gave me, but my goodness, I'm missing it. It's a bit like giving up coffee. That's how I describe it, or other allowed drugs is how I describe it. They said the diet usually lasts about a month. Some people can take a couple of months to truly notice a difference. And I went, tick, all the same stuff. And then they talked about the amines in food. They talked about caffeine, as in coffee, tea, and soda. And those things don't just contain caffeine, they contain the natural salicylates, the natural amines, etc. They talked about chocolate. They talked about MSG. They talked about processed meat, where you get lots of amines and nitrites, aged cheese and dairy products, nuts, where you get lots of amines and salicylates, alcohol and vinegar, and then sweetened fruits and vegetables. And that was one where I coloured it up. And as you know, I'm great in doing colour ups. And I coloured up yellow highlighters, yellow for amines, green for salicylates, and pink for additives like nitrites. And you can see just with this example of the fruits and fruit juices, the sort of things that you're taking out in the diet, you're significantly reducing your chemical load. They talked about onions and sauerkraut and kimchi. And then there was this great statement, fresh yeast risen baked goods. And they said, let them sit 24 hours because of the natural glutamate, etc. They also talked about was aspartame or saccharin or those sorts of things.
Your artificial sweeteners, yeah.
Yeah, the artificial sweeteners. On the elimination diet, all those years ago, I decided that there were a few articles in the literature saying artificial sweeteners were a problem. They were often in association with like a food or a drink. And again, I'm not sure whether it's the sweetener or whether it's the components with it, the flavour, the preservative, the colour. But because I did not know much about it, I decided that we would just stick with pure sugar. And so I always say to people, if you want to check those ones out, try them out. My experience is that it's better to have a little bit of regular sugar than a truckload of commercial foods that contain artificial sweeteners and all the other stuff that they have to put in there to make the artificial sweetener taste. You know, they'll increase the flavour of it out of sight. They have to increase the preservative, etc., because otherwise it's going to go off. They talked about, and I hope you don't mind, they talked about soy products, and a lot of patients come in saying, I think soy is a problem. But when I ask them what do they mean, and this article says the same, they talk about miso, tempeh, soy isolate, soy sauce. And again, if I can just show you that, it talks about soy milk is less likely to be a problem and soy oil is fine. You can see my colours there. Yellow is for amines and orange is my colour code for MSG. So it's not the soy in these products, but it's much more that the soy is broken down and the protein releases the natural glutamate. And then lastly, they talked about leaving leftovers in the fridge, because that's one where, again, or crock pot meals or a broth, because a lot of people are using broths nowadays. Those things mean that the protein breaks down. You get lots of amines, you get lots of free glutamate. They taste absolutely yummy, but you're better off just to use a little bit of regular salt, because now that we're on this no fat, no salt, no sugar diet, we're increasing the flavour content of our diet, and that's when we can get into trouble. The last little bit I found interesting though, other potential triggers include tomatoes and mushrooms and a number of other things that are completely individual. And they say while mushrooms and tomatoes aren't on the no list, they could be triggers. And then they say, I've also seen people with seemingly random triggers such as cinnamon, spinach, strawberry, and shellfish. And again, the same thing, you can see those things contain lots of the natural chemicals and natural salicylates particularly, as well as amines and glutamate. So I would look at this diet and say they've taken the top off things, but if you really want to get to the bottom of things, the quickest and easiest is to be strict, let your symptoms settle, do a series of challenges, and then you can move on and add things back into the diet. I'm often known for, when I see patients, talking about getting back in the driving seat. getting back in control. It's not the foods that are dictating your life, and it's not your symptoms, it's you.
Mm-hmm.
And then if you choose to have extra foods, what the heck? If you know you're going out on the weekend or there's going to be a special lunch at work or whatever, then you can be careful, low chemical beforehand. You can have a big dose and you might suffer, and then you can be careful afterwards so you can be back in control. And even when you have this big dose, you might say to yourself, I'm going out to dinner. I know I'm going to have extra foods. Take some medication beforehand and see if that helps as well. So that again, like I said, you're back in control.
That's fantastic advice. So if someone with migraine does want to have a go at the elimination diet, what's the best way for them to go forward? Should they work with a dietitian?
They can get the resources online or from the office. And there is our elimination diet handbook, but there is also a recipe book called Friendly Food, which you can get in any good bookstore, put out by Murdoch Books. But I think it is important to do it with a dietitian, because you don't want to go on the diet and leave certain things in there or make little mistakes and go to all that hard work. And then you find that things are improving but not settling completely. And then you go and see somebody and they say, but what about this and this and this? So my advice would be, first of all, go and speak to your doctor, be it your GP or your neurologist. Let them know that you are finding that some foods seem to exacerbate your symptoms, and you thought you would like to do an elimination diet and challenge procedure. Be prepared that they might try to discourage you, because often they're foodies and they don't like the idea of you doing some strict diet. But what you need to know is that the elimination diet is a diagnostic tool. It is not forever. If you go on the elimination diet, you need to know that you could very likely go through withdrawals in the first 2 to 3 weeks, so be prepared for that. And that usually you will notice a change in the first 2 to 4 weeks, but it may take 6 or 8 weeks to settle down. And then once you've settled down on that diet, then there is a series of food challenges, and everybody loves them. The food challenge for amines is lots of cheese, chocolate, bananas, da-de-da. And you might look at me and go, oh, I know the answer to that. Well, you don't have to do that one then. But you might want to know about the salicylates and the MSG. And so the food challenges are actually fun times as far as food is concerned. And what you're wanting to do is to see whether if I eat a whole lot of those on a clean baseline, does it make any difference to my symptoms? Because then long term, you know whether you need to be careful or not. When you do the challenges though, you do not have to make yourself horribly sick. What you want to do is just break through that threshold and go, oh, I know where this is going. You don't keep going. You go, all right, I know I'm sensitive, stop it. Because I don't need to see how bad you get. I just need to know, and you need to know, is it a problem? And then long term, you can do the juggling act. But I would do it with a dietitian, because then you've got someone to bounce off and you've got someone to guide you through. And we do have resources on our website. If you're wanting to find a dietitian, you can look up the DAA, the Dietitians Association of Australia, and they have a list of dietitians around the country who work in the area of food intolerance. And they would definitely be able to help you and to make sure that you have a nutritionally adequate diet while you're going through the diet, and then long term, once you know what you're sensitive to.
That's great, Anne. Thank you so much. We'll put those links underneath the video. Thank you so much for making the time.
It's a pleasure. Thank you for asking me.